So there are two types of treatment to the neck to restore joint motion. One is a manipulation or a thrust manipulation. The other is a mobilization. A mobilization is a gentle version of a manipulation. The hand contacts are the same, but what it is slow and steady wins the race. A mobilization technique is typically actually more successful because there's a very low likelihood of injury. And so when we're looking at the neck here, this red line here is a vertebral artery. It actually goes between the transverse processes of each cervical vertebra, and it's actually tethered. So during a thrust manipulation, what can happen is the vertebral artery can be stretched, causing a tear to what we call the intimal lining or the inside lining of the vertebral artery. That can form a clot, and then with the following manipulation, that clot can go up into the brain. Now that's very, very unlikely and very uncommon, but that is a risk with neck manipulation. The other is sprain to the joints. So mobilization technique, same technique, just on the gentler side. What we do is we keep retesting mobility to see have we actually changed anything. So the C1, C2 rotation test is a test that we do to see how far is C1 and C2 rotating. How far is that moving? When we do our treatment techniques, we want to make sure that we're actually making a difference. So from a neck perspective, we have a mobilization technique, which is same hand contacts as a thrust manipulation. It's just a matter of the speed and how quickly the technique goes. In the neck, what we find is what works better over time seems to be a mobilization technique.